Pancreatic cancer is one of the most challenging types of cancer, often called a silent disease because symptoms frequently don't appear until it's in advanced stages. According to recent statistics, pancreatic cancer accounts for about 3% of all cancers in the United States, but it's responsible for nearly 7% of all cancer deaths, making it one of the deadliest forms. Each year, around 60,000 people are diagnosed in the US alone, and unfortunately, survival rates remain low, with only about 12% of patients living 5 years beyond their diagnosis. Hi there, and welcome to my channel. I'm Dr. Smrita Singh, and I'm an MD and wellness expert. Today, we're going to discuss an important but often misunderstood topic, pancreatic cancer. In this video, we'll go over the basics of pancreatic cancer, including what it is, who it affects, the symptoms, how it's diagnosed, and treatment options. Let's dive in. To understand pancreatic cancer, we first need to understand the pancreas. The pancreas is a small fish-shaped organ located just behind the stomach. It has two main functions, producing enzymes that help with digestion and releasing hormones like insulin, which regulates blood sugar. Pancreatic cancer typically begins in the cells lining the ducts of the pancreas. When there is a change in the DNA of these cells, they start to multiply uncontrollably, forming clusters called tumors. If left untreated, these cancer cells can spread beyond the pancreas to other parts of the body, a process known as metastasis. While anyone can develop pancreatic cancer, certain risk factors increase the likelihood. Most cases are diagnosed in people over the age of 65. Several other factors can raise your risk. Number 1 is smoking. Tobacco use is one of the biggest risk factors for pancreatic cancer. 2 is diabetes. Both long-term and newly diagnosed diabetes can raise the risk of pancreatic cancer. Number 3 is chronic pancreatitis, which is long-term inflammation of the pancreas that can lead to cellular changes over time, causing pancreatic cancer. Number 4 is family history. If you have a family history of pancreatic cancer or certain genetic conditions, your risk might be higher. Number 5, being overweight can increase inflammation in the body, including in the pancreas. Number 6, combined lifestyle factors. Research shows that having a combination of smoking, diabetes, and an unhealthy diet significantly increases the risk of pancreatic cancer beyond any one factor alone. Unfortunately, pancreatic cancer often doesn't cause symptoms until it's advanced. But there are some signs to be aware of. First is pain in the upper abdomen that may radiate to the back. The next one is unintended weight loss and reduced appetite. Third is jaundice, which is a yellowing of the skin and eyes, which can occur if the tumor blocks the bile duct. The next one is digestive issues, which can cause light-colored stools and dark urine, which are common in pancreatic cancer. Itchy skin can also occur in pancreatic cancer. It is caused by a buildup of bile in the bloodstream. Developing diabetes or having difficulty in managing it can also be a symptom of pancreatic cancer. Increased fatigue, which is a constant feeling of tiredness, can be a sign of pancreatic cancer. Sometimes blood clots can form due to changes in the blood caused by the cancer. If you notice any of these symptoms, especially if they are persistent or unusual, consult your doctor. If pancreatic cancer is suspected, your doctor may order a series of tests. These can include imaging tests like ultrasound, CT scans, MRIs, and PET scans, which can provide a clearer image of the pancreas and the surrounding organs. Endoscopic ultrasound. In this test, a small camera is passed down through the esophagus and into the stomach, allowing the doctor to see the pancreas more closely. If necessary, they may take a small tissue sample for testing. Some pancreatic cancers release specific proteins called tumor markers into the blood. The CA19-9 marker, in particular, is often elevated in pancreatic cancer patients, although it is not specific to this cancer alone. If tests confirm pancreatic cancer, the next step is staging the disease, which helps determine how far it has spread. Stages range from 1 to 4, with higher numbers indicating more advanced cancer. Don't hesitate to ask questions or seek a second opinion to feel as informed and comfortable as possible with your diagnosis. Treatment depends on various factors such as the stage of cancer, your overall health, and personal preferences. Common treatments include chemotherapy. These are drugs which are used to kill cancer cells or slow their growth. Chemotherapy can be used on its own or combined with other treatments. In radiation therapy, high energy beams are directed at the cancer tissues to kill or shrink the cancer cells. If the cancer is localized, surgery may be an option to remove the tumor and surrounding tissue. The most common procedure is the Whipple procedure, which removes part of the pancreas, bile duct, gallbladder, and some parts of the stomach and small intestine. Research is constantly evolving, and clinical trials test new treatments or combinations of existing ones. Talk to your doctor to see if you might qualify for a clinical trial. Palliative care is a specialized care which focuses on managing symptoms and improving quality of life. It includes pain management, nutritional support, and emotional care. It's often combined with other treatments to ease discomfort. Being diagnosed with pancreatic cancer is challenging, not only for patients but also for their loved ones. Here are a few suggestions that may help. First one is to learn about your condition. Understanding your condition and treatment options can help you feel more in control and make informed decisions. Seek support. This can be a support network of family and friends, a cancer support group, or a mental health professional. Connecting with others who understand what you're going through can be very comforting. Consider hospice care. For those dealing with advanced cancer, hospice can offer comfort, support, and resources to patients and families alike. Hospice focuses on quality of life, emphasizing relief from pain and emotional support. Take it one day at a time. Each person's journey is unique, and it's okay to take things one step at a time. Lean on those around you for support, and remember that there's no right or wrong way to cope. Thank you for joining me in this video on pancreatic cancer. I hope this information has given you a clearer understanding of this condition, its symptoms, and treatment options. If you or a loved one is facing pancreatic cancer, support is available and there are many resources to help guide you through this journey. If you found this video helpful, please give it a thumbs up, share it with others who might benefit, and don't forget to subscribe for more content on health and wellness. Take care, and I'll see you in the next video.